For my pathophysiology Module 15 presentation, I decided to do it over the disease of rheumatoid arthritis. Rheumatoid arthritis is a progressional chronic disease. This means that there are things that can help it treated, but it never completely goes away. What rheumatoid arthritis is it's an inflammation of the synovial layer, which is the membrane lining in your cavities of your joints. This is your knee, your elbow, your ankle, your hands, your fingers, your feet, your basically every joint except for a few in your body. This can lead to destruction of the cartilage, of the bone, and later on it can weaken and stretch the tendons and ligaments, making the deformity that you normally see associated with rheumatoid arthritis. And the etymology of it is the serous membrane becoming inflamed somehow. This can be due to your genes. A lot of people, if it runs in your family, then you may have it. Females are more likely to have rheumatoid arthritis over males. Smoking can be a risk factor in this, as well as obesity and environmental exposure. Just as an example, a lot of people that were exposed to the dust during 9/11 or have a higher risk of having rheumatoid arthritis than people who were not. This disease falls into a autoimmune syndrome. So this is whenever the body attacks itself. So whenever the synovial joint becomes inflamed, your immune system isn't fighting it. And it's fighting its own body. And this is what happens and makes the redness and tenderness and well as the deformalities of this. Some signs and symptoms are pain in the joint and tenderness, even to the touch. Sometimes you'll touch people and they scream for pain because it hurts so bad. The joint will become red as well as swollen, and also they will become stiff. Normally once the disease is starting, they are just stiff at some certain points. A lot of people experience morning stiffness, which is whenever they have a difficult time getting out of bed in the mornings because they are so stiff. However, once the disease progresses, it's where coming from a seat to standing or standing to seating is difficult for them, as well as getting up and down off of things. And then later on, it can even be deformalities, which is where their fingers can become hooked and it's hard to grab things. Their hands can be all disformed. So this causes complications throughout the whole body, even though you think it just affects joints, which it does. It can affect your whole body, including your eyes, your heart, your lungs, your muscles, your whole mindset, your emotions. A big risk factor that comes with this, or complication that comes with this, is depression. Because people get so depressed because they're hurting constantly. It affects your skin, and so that there are rheumatoid nodules, which are lumps of tissue that build up, and they're normally on your elbows, your forehands, your heels, as well as your fingers. If you look up rheumatoid arthritis on the internet, one of the first pictures you'll see is a deformed hand with red bumps. Those are those rheumatoid nodules. Also, of course, it makes your whole body have a fever because the joints begin to have a fever, and once you have this disease in more than one joint, your whole body naturally runs into a fever to try to fight off this inflammation. Your body's trying to get rid of it. You can also have heart problems due to this and lung problems because those rheumatoid nodules can grow on the heart as well as the lung. Even though you would think they just affect the skin, it affects your whole body. You can begin to lose your vision. Your eyes can become dry and grainy. And you can also get, you're very highly to get osteoporosis. A lot of people get it already, but even more people get it with rheumatoid arthritis. There's also, along with the dry eyes, there's also dry mouth. Due to the medications that rheumatoid arthritis people normally take, it's an immune suppressing medication. This medication makes your body very, very, very sensitive to infections, and you're 10 times more susceptible to get infection than someone who is not on these immune suppressors. Also, just the rheumatoid arthritis itself can cause an infection because your immune system's already weak from the inflammation. Abnormal body composition, so it can affect your whole body with your hands. It can begin to shift your ankles as well as your toes. You have carpal tunnels, which is in your fingers, and lymphedema can be another big thing. Also, you think normally of just, it's in your elbow, your shoulder, your knee, but it can also be in your neck. So if you have neck pain doing this or this simple motion, it can be, part of that can be rheumatoid arthritis set up in your knee. And also, the biggest percent of people that have rheumatoid arthritis are from the age of 40 to 60, and most of it has to do with their genes, but there are people who are as young as teenagers get diagnosed with this. I personally knew a girl that got diagnosed with this at the age of 12. So it's rare in children, but not unheard of. So a way that they diagnose this disease is they do blood tests. And if you have an elevated erythrocyte dissemination rate or a C-reactive protein, this can indicate the presence of inflammation in your body. They cannot just do this test once. They have to do it more than one time in order to definitely rule out anything else. Also, they do another blood test that they look for the rheumatoid factor as well as the anti-cyclophosphamide peptide, or the anti-CCP antibodies, and if this is elevated, again, this is a big factor for if you have rheumatoid arthritis or not. This blood test also has to be repeated more than once. They can also do some imaging testing, such as x-rays, to see if they see any rheumatoid arthritis. And the way that they can tell that this is different is because if it's just normal osteoarthritis, that's from wear and tear, from where your bones are just connecting, or rubbing. But the rheumatoid arthritis, so if this is your knee, it's the outside part where my thumbs are. And so, and my thumbs and my pinkies. So if my middle fingers are my joints, then here are my synovial linings. And the synovial linings is what is affected, not the actual joint itself. So they can see this on x-rays, and this is how they can diagnose through that. Some differential diagnoses that are commonly affected with rheumatoid arthritis, since it's not exactly the same as osteoarthritis, they can be a viral infection, such as parvovirus, hepatitis B, as well as rubella. And as I stated before, some lifelong complications, they include all of those things with your body, your vision loss, your neck pain, your body pain, not being able, a decreased range of motion. Depression is a big one. And this is just all due to the abnormal response of your immune system, which leads to inflammation and joint damage. So thank you and have a great day.